Let's talk about how when someone gets a herniated disc in their neck. So, Claudia, you have a neck model there. Can you show them, the audience, the viewers, what a herniated disc, where the disc is, and actually what is a herniated disc?
Okay, so here when we're looking at the model, this is basically you're looking at it from the front end, and you have the disc in between. The disc are the cushions that support the spine. When you have a herniated disc, you have the disc bulging through, basically tearing through the annulus and going into the spinal canal. Sometimes it compresses the nerves here, and patient will have some of the symptoms like the burning, the numbness. This also will cause patients to have pain, either going down one arm. Sometimes they'll have pain going down both arms, and they'll be symptomatic.
So if we were to go into that model, you were talking about my neck issue earlier.
Yes.
Where's that going to be?
In your case, basically, you're in your cervical spine. Basically, here we have the neck. So as Claudia was mentioning, we have the disc, which are the structures that we have in between the bones. So normally we count from up down. So basically, this is vertebra number 1 over here. We count number 2, number 3, number 4, number 5, number 6, number 7. So I will say that most likely your symptoms, without having an MRI, might have been stemming from this level over here. So most likely you might have a disc that might have slipped back, like Claudia was mentioning, and that could have led into touching those nerves in the neck, and that could have led you into having the symptoms that you're presenting in the shoulder blade area. So what things we can do in order to treat a herniated disc? What type of treatments normally we go ahead? So typically we start the patients on a physical therapy program, right? So normally our role, like Claudia and myself, normally we assess the patient most of the time. We just want to make sure that they're not having any neurological sequela, and then they start them on an exercise program. After that, normally once they complete the exercise program, we have the aid of someone like Brian that they can help out the patient to help themselves strengthen the muscles, and maybe you can toss in about what you do over there.
Yeah, so I went on the journey of self-treatment, right? Because I didn't think to continue to pursue a doctor. I didn't think it was a disc herniation or a disc bulge. I just thought something tensed up and just locked up, almost like a contraction or a contraction that just wouldn't stop firing. So what I did was I did a lot of mobility work towards that thoracic spine, and then a lot of pulling exercises to help re-strengthen those areas of the muscles that you don't see in your back.